Well, we are going to be talking about endometriosis today. We are bringing different topics every single day so that, sometimes it's on women's health, men's health, but majority of the time, we focus on women's health. So today's topic is how acupuncture can help with endometriosis if you are struggling with it. So we have a special guest, an acupuncture Dr. Jules Miller. She will be joining me in 1 second, and we will understand what exactly is endometriosis. Hello, Dr. Miller. How are you?
Well, good morning. I'm great. How are you?
I'm doing great. Thank you. Thank you so much. This is a very special, a very deep topic, right? For a lot of women, if they are going through endometriosis.
Yes.
And thank you so much. I know you are a board certified acupuncture physician and you focus on fertility and women's health. So let's just start with what exactly is endometriosis, and if you'd like to tell your story, please go ahead.
Oh, sure. So as you mentioned, I am an acupuncture physician. I do own Health Point Jacksonville, which is an acupuncture clinic, and I have been treating patients for the past 27 years. So I do specialize in not only chronic pain conditions, but also women's health and holistic fertility. And I encourage women to feel healthy and happy in their bodies, inspiring and empowering them. And it's my life's mission to have my patients have more good days than bad. Yes. So in that, I found myself treating fertility approximately 15 years ago, and endometriosis is one of those conditions that we treat. So it's not necessarily specifically to fertility, but it is a chronic pain condition that I see over and over and over again. So
what is the cause? Why are you seeing more endometriosis now, right?
Oh gosh,
maybe 15 years back or something.
That's a really controversial topic, and there's so many different causes to endometriosis. So I'm going to backpedal just a little bit about endometriosis and introduce it. So it is a chronic pain condition with an autoimmune component.
Wow.
Yeah, so it's really complex. And so specifically, it's where endometrial tissue that's normally supposed to be in the uterus finds itself outside the uterus, and it continues to grow and proliferate in that area. Mm-hmm. So it will then bind and adheres to the area. Common areas that it will bind to is going to be the neighboring areas. So it's going to be like the urinary bladder, the intestines and colon, fallopian tubes and ovaries, and it continues to bind onto it. And it still acts, though, just like uterine tissue. So that means that it continues to thicken, grow, and that tries to leave the body, yet it can't because it's not in the uterus. So it's just trapped in the area. And then because it's trapped in the area, it continues to proliferate and form these adhesions, which act like a spider web, I say, because it's really thick, dense, fibrous tissue, and it will just continue to grow and grow and grow because it has nowhere to go, and then it kind of suffocates that area. So, and that then causes just a whole, just a chain of events that happen that causes this chronic pain that happens in women. So, and it can happen now. It's just so blows my mind how many women it affects, and it can happen in girls as young as 8 now, all the way through postmenopause. So it's just the wide gamut of women that it can affect. And then I'm going to throw in one more statistic, which probably everybody knows about endometriosis, and if you don't, it affects 1 in 10 women in the United States. So it's very, very rampant.
Mm-hmm. That's crazy, and I mean, that sounds really scary. Something that's supposed to be in a container gets out of the container in a very simple layman's term, and of course it's spilled out, and now there is a splatter. Whatever the splatter, now you got to fix it.
And it's systemic. It can be found anywhere in the body. So it's not just that it's going to be in the local area, but it's been found in the liver, the lungs, the brain. It can affect any tissue in the body. So that's what's really difficult about this condition.
Okay. Well, okay. So now, and the symptoms would be like pain. That's what I'm assuming.
Yes. So correct. So the number one symptom is going to be that chronic abdominal and pelvic pain. But there's a wide variety of pain that women can experience. So it's going to be painful urination or painful bowel movements, painful intercourse. There's also gut dysbiosis. So that's where it's now infiltrating the digestive system. And many women, if not all, I think that's probably arguable, experience gut dysfunction. So there's the endobelly, the chronic swelling and bloating. There's going to be constipation or diarrhea, nausea, vomit. So these symptoms, they look like something else. They look like maybe irritable bowel syndrome. So it's hard to actually make that diagnosis because there's all these symptoms that happen. Two more symptoms that we're going to talk about is going to be migraine headaches as well as nerve and neuropathy pain. So that's also something that's not necessarily thought about when patients have this nerve pain, and it's going to be localized pain. It's going to be vulvar pain, maybe vaginal pain. It's going to be rectum or hip or low back pain. And maybe when that's experienced by itself, maybe that's not necessarily caused or associated, but when you have multiple symptoms, maybe it's time to start thinking about that endometrial tissue that's now infiltrating and proliferating in that area. So a lot of symptoms.
Lot of symptoms. So how do you diagnose? Do you do tests as a first step to understand what, whether there's an endometriosis or something else that's going on, like IBD?
Right. So acupuncture physicians are not able to. The only person that's able to, or I'll go with person. The only person that's able to diagnose endometriosis is actually via having laparoscopic surgery. That's the 100%. However, there are other signs and symptoms that when you're doing an evaluation on a patient, you say, oh, yes, that's definitely something that we're going to consider. And then we're going to go really rifle through menstruation and see what that looks like for the patient. And when there's multiple symptomology, well, then we'll think, well, let's think about this and let's start to dial down that chronic inflammation. Let's regulate menstruation and balance those hormones and see if we can't get a hold of that chronic inflammation so that we can improve the quality of life. And then, of course, then I'll refer out and suggest maybe chatting with the gynecologist and or seeking a very specific trained endometriosis expert, which we have one here local in Jax that I will constantly send my patients to, thinking, I think these are big flags and I think that this person needs to be evaluated further.
This is a very complex, way, even the treatment, like it's not only acupuncture, but there are other things that are involved, right? That's what I'm understanding.
Oh, for sure. So even in my approach with my patients here, generally I treat patients for endometriosis that are patients that are seeking to conceive, trying to have a baby. So that's one of the complications with endometriosis, and it affects 50% of patients with endometriosis is difficulty conceiving and or carrying to term. So that's generally when I see the patient first, and they may not have even had a diagnosis yet, but they've suffered all of these things. And when I do my evaluation and I put them on a treatment protocol, I think, oh, we really need to think about this in the treatment process. And sometimes because there's different stages of endometriosis, it can be treated and moderated without having surgery, but when it gets to advanced stages, then it's going to require surgical excision.
Wow. Okay. So let's, this sounds really scary and complicated. And I see a lot of people joining. We are talking about endometriosis and how natural therapies can help. That's the topic on a journal level. So you've asked questions. So let's go a little bit on the acupuncture side. And how can acupuncture help with such a complicated health concern?
Right, that's an excellent question. So acupuncture involves the whole gamut of Chinese medicine. So Chinese medicine practitioners will look at, the whole scenario as opposed to treating specific diagnosis. And we also employ multiple modalities. So it's not just using acupuncture, which is very strong and helpful in and of its own, but we also use Chinese herbal formulations as well as herbal supplementations. We utilize electric stimulation that helps to break up adhesions and dial down inflammation. Sometimes we use something called moxibustion, which is the burning of a specific herb to help warm up the area as well as decrease inflammation. We can use topical applications too. So we utilize so many different modalities to try and treat what we see. And generally speaking, it is a treatment protocol. So it's never going to be like a one and done type of treatment, especially for syndromes. So we put patients on a very specific program to see what kind of progress that we're making, to thus then manage the chronic inflammatory process that's happening, as well as dial down the immune system, which is really overactive at this time. So it's attacking itself. So we've got a couple of things that we're trying to focus on.
So you're working in conjunction with the OBGYN or some other expert as well. That's what kind of what I
Well,
understood.
we can. So in the beginning, perhaps not. It just depends on what stage the patient is in. If the patient is in such severe stage of endometriosis, they're vomiting and they're passing out with pain and they're missing school or work or life events. These are really significant signs that if they haven't been to their OB-GYN or they haven't been evaluated by an endometriosis specialist, then I will also refer out. So we can certainly treat the same patient, but at some point in time, there are times that I will refer out for just advanced specialist evaluation so that perhaps to diagnose and or decide if they're a surgical candidate.
Sure. So it depends on the severity of the stage of, right? That's
correct. Correct. It can be very well managed and moderated through the first 3 stages. So there's 4 stages, but once it gets to the 4th stage, it can be helpful. But at some point, there might need to be other alternatives as well. And I will say that in my treatment and in my patients, I also advise in lifestyle changes as well as nutritional changes to further dial down that inflammatory response, which helps to also appease that immune system as well.
So now, okay, so let's talk about acupuncture and Chinese medicine and moxibustion. So the protocol is like approximately like how many months are you looking at? I mean, for
right. So when treating patients with this chronic condition, I actually will approach it in a regulation of menstruation type of category, which means that I'm looking for a patient to have a regulated menstruation of just 28 days. We're looking at ovulation at a specific period of time, and we're looking at 4 days of moderate blood flow, no clotting, no spotting, and no pain. And that sounds like the unicorn of unicorns to have for menstruation, but it is possible. It just takes some time. So generally speaking, the minimum amount of time it takes to do that and to regulate the hormones is going to be approximately 3 months of care.
Wow. Okay. And then you monitor on a monthly basis or whatever time frame, and all these tools that you talked about, you use all these tools, right? It's not only
all of them,
right? Moxibustion, Chinese medicine, everything encompasses, right?
Correct, as well. Yep.
And what about the exercise? Do you also recommend like some kind of is this stress part of it? I guess that's the question.
That's a great question. Yeah. So stress relief techniques are definitely something that we suggest and have our patients do as well, suggesting them to whether or not they're doing meditations or whether or not they're being active. So exercise is really important, as well as maybe self-care and maybe doing some yoga and just taking some time out for the person, because it also, chronic pain, no matter if it's from endometriosis or, say low back pain or neuropathy, chronic pain also affects you emotionally and psychosocially. So trying to take care of the anxiety and depression involved and insomnia that happens too. So acupuncture is great at helping that, but so are life skills and specific lifestyle changes.
So things like Tai Chi or Qigong or meditation, yoga, any one of the combination, right?
Agreed. Yep. Yeah. Deep diaphragmatic breathing, Qigong breathing, kind of the same, maybe just different terms, but absolutely can help to decrease pain. When patients are in active pain, so maybe active menstruation pain, I also teach them to do an active release technique, which is really helpful at helping to quickly release that abdominal spasm and cramping. So I teach them how to do that at home as well.
Okay. Well, a lot of information and great information for all the women or girls, who have endometriosis or who have some pain, that if they're struggling with some pain, that the intent of this particular session is that acupuncture can help. Natural therapies can help. That is the goal. And maybe before going to the surgery, you might want to explore natural therapies, right?
For sure. Yeah. Agreed.
Yeah. Anything else you'd like to add? I mean, this is amazing information, Dr. Miller. I think.
It is my passion to treat women's health and regulate hormones, because I do believe that menstruation is the 5th vital sign to women's health. So if it's not functional and you're not being functional with menstruation, then that's a big sign and it's a big flag. So I like to educate women about that, as well as what menstruation can look like. But I think the number one message here is that it is 100% not okay to have severe menstrual pain, no matter how many practitioners or other people, maybe even in your family, that's kind of, endometriosis can be highly genetic. And so it's passed down from generation to generation. And maybe that's kind of like the family folklore. Well, oh, well, we had painful periods, just take this and go to bed type of thing. But I'm here to tell you that it's actually not normal. While it is common, it is not normal, and it is very treatable. So I think that's my takeaway message.
No, I think there is hope, and that's what you are saying, that do not ignore the symptoms. If you have pain in any part of the abdomen or anywhere close to your uterus, take it seriously and reach out to an acupuncturist such as Dr. Miller or someone else close to your area.
Correct.
Yeah.
Agreed.
Yeah. Thank you so much for a very insightful session. I see a lot of people are joining. I think maybe there's too much information we are giving, but
yes,
but this is important information. This is important information for all the women out there to understand that there is hope in natural medicine, and don't ignore it.
Very much so. I agree. And if you, ladies and women and gentlemen, anybody has any questions, I'm happy to answer. If you want to throw up a couple questions right now, I'll answer, or you can reach out to me directly as well. I'm sure that maybe my contact information can be provided, and I'm happy to answer any question that anybody has if they're confused or they have all these symptomology. I know that when I do informative videos on my own website, a lot of patients are they're blown away. They say, wow, I have all this all the time. And I didn't know that was a problem. I just kind of experience it. Or I've gone 8 years and I still don't know what's causing this. And I miss school, or I can't go to certain events. So there's definitely a lot of people that can help you. And perhaps one of the number one ways to go is going through a Chinese medicine practitioner or acupuncturist that can help diagnose and or send you to the correct area if that's not helpful to you.
Yes, absolutely. And people are welcome to ask questions. I see people joining. Maybe they missed some of the things that we talked about, but you are welcome to reach us and we'll connect you with Dr. Miller. That's not an issue. And if people have any questions about this particular acupuncture, how acupuncture can help, reach out to either one of us. We are just trying to provide education, empower you. That is our goal on every single day basis. So with that, I'd like to thank you so much for doing this session with us. And yes, thank you from the bottom of my heart for educating all the women out there.
My pleasure. Thank you for having me.
Absolutely. Thank you. Bye-bye.
Bye.